right, being 6 o'clock, we'll call the Marathon County Board of Supervisors to order, please. We will start with the Pledge of Allegiance. Please remain standing. Following the Pledge of Allegiance will be a silent moment of reflection. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We will have the reading of the notice, please.
An educational meeting of the Marathon County Board of Supervisors will be held at the Marathon County Courthouse Assembly Room, 500 Forest Street, Wausau, at 6 p.m. on Thursday, October 17th, and the agenda was duly signed and posted.
Thank you. I'd like to request everyone please silence their cell phones or put them on vibrate, so that they're not to be an interruption to the meeting. And I thank you for your compliance. And we'll move on to roll call, and I'd ask everyone to please sign in. Thank you. We do have a quorum. We have 23 people present physically. We also have 6 individuals via WebEx. So we'll move on. To item number 6, welcome to all of the visitors that we have with us tonight in person, and also the viewing audience. And thank you for your interest in county government, and thank you for your interest in Marathon County. We will move on to item number 7, and that is public comment. We have one individual that is registered to give public comment per our rules. He will be allowed 3 minutes to address the board. And I'd invite Mr. Christensen to the front of the mic and make your comments and address those comments to the chair. Thank you.
Thank you, Mr. Chair. My name is Alan Christensen. I live at 169488 River Road, Ringgold. I'm town chairman in the town of Ringgold. I'm here to give our take on the gas recovery at the Marathon County landfill. We are not opposed to the gas recovery. A lot of people are always asking, why are you opposed to this? What we are opposed is the heavy industrial zoning that the ERC has proposed. What the town of Ringgold is, yes, the industrial zoning. Landfill came to Ringgold with a lot of opposition from the town, but we still ended up with the landfill. Now with the heavy industrial zoning, we are afraid of what's going to come next. More industry. What the town was hoping for is a special zoning district for the processing of the landfill gas. On July 2nd of this year, we came before the ERC to plead our case, but we lost then. We decided to go to the Board of Appeals, but it came back to the town of Ringgold that if we would drop the Board of Appeals, we would get a new hearing for the ERC. Now we've lost that. So now that I'm here to hope that the board will understand that how we feel. We keep hearing that if there's more industry coming, that there will be another hearing, but you can see how that turned out for us. So I'm hoping that everybody just be a good neighbor, and thank you. That's all I got. Thank you, people, and thank you for the board.
Thank you. That's all we had signed up for public comment, and so we will move on to item number 8 on the agenda, and that's educational presentation reports. First under item 8A is standing committee chairpersons or designees. Any reports by chairpersons and or designees? Okay, we will move on then to item 8B, and that is the annual update from the ADRC. And we have with us the ADRC Director, Mike Rea. Mike, please.
Good evening, everybody. Thank you for allowing me the opportunity to give you an update. Just as a little refresher for some of those of you that may be newer to the board, the ADRC of Central Wisconsin is a 4-county organization that makes up Marathon, Wood, Langlade, and Lincoln counties. We're formed by those 4 counties through an intergovernmental agreement to be able to provide the Resource Center services, or the ADRC services, and the Older American Act programs for those 4 counties. So as a part of that, I come to each of those county boards and provide an update to you on an annual basis. So some of you have heard my spiel before, but I'll give it anyway. So what the organization does, we are the one-stop shop for anything that's related to aging and disability. It could be anything from identifying a resource for individuals to be able to connect with, to sitting down and helping individuals plan what support and that they may need within their homes to keep them as healthy and independent as possible. That could be as much as looking at what their personal finances are and how those resources are able to spread out and be able to provide for their own needs, or if they're unable to pay for those on their own, we are also the entry point into the Wisconsin long-term care programs as well. We are what's called an integrated organization, so we have 2 separate sides to our organization. So we have the ADRC side, which is what I just talked about, and we also have the Older American Act program that provides supports and services as well. Some of the most familiar ones are our Meals on Wheels program, as well as our nutrition programs, support for caregivers, and our dementia care specialists as well. So over this last year, just to give some highlights in regards to some successes that we've had. We've really tried to look at our organization as a whole and how to be able to provide the best support and services across those 4 counties consistently and to have the same high level of service throughout each of those counties. So one thing that we implemented within this last year was the regional call model, where individuals call into our organization and they are able to get a live person on the phone when they're calling into that organization and actually connect with the right person at the right time. We've actually going to that regional call model, so you may get answered from anybody within our region, but with that you're getting to a specialist that can help support your needs in a quicker fashion. We went from about a 50% answer rate, live answer rate, to about a 90% live answer rate, which means that there's less phone tag, there's less trying to connect with people, there's less staff time. Trying to connect with people, and people are getting answers quicker. So really excited about that opportunity that we've implemented and that efficiency with that. One exciting thing for Marathon County is we recently, within the last couple of months, month and a half, opened up a dining site location, and it's a really unique dining site. We call it Cafe 60. It's where we contract with a restaurant, a local restaurant, and offer meals for individuals. They can get a voucher from us. They can go to that restaurant and get a meal. We're working with Vino Latte, which is that would be the western side of the city. Very popular place. If you haven't been there, got a great selection of food. We worked with them to develop a menu that's specific. People can get vouchers from our organization if they're 60 and older. There's a suggested contribution of $5, so it's still a really good deal. People aren't able to pay the contribution, they're still able to get the coupons and the meal. It's a really cool model because you're able to go to lunch with somebody. You can go anytime that the restaurant is open and go to their meal. They do have breakfast options and and lunch options as well. So really excited about that opportunity and that model coming into Marathon County. Another really big highlight of something to come is that we are moving our Wausau office to the Lakeview campus. So we worked a lot with, I worked a lot with Lance, and we hammered out a contract. That's a win-win situation. You know, we're moving into the campus where there's a lot of human service agencies. We're also going to be paying rent to Marathon County for that space, which will be beneficial as well. So we're really, really excited about that. That's going to be happening in March of 2025. So really pretty excited about that. We also have definitely experienced some challenges over this last year. One thing that, even though the pandemic was horrible, and we can all agree that it was horrible, one thing it did bring to us is some dollars through the ARPA funds to the tune of about $400,000, and we were directed to utilize those for specific programs. So we utilized them for those programs, but now those dollars have gone away. So now it's really trying to look at how we plug that hole and how we maintain our budget and maintain our services at the level that serves all of our customers. So we've had some challenges within that. That's not going to go away. That's some challenges we anticipate going on an ongoing basis. There is some advocacy efforts. Most of our program is funded through state and federal dollars. So there is advocacy efforts going on at both the state and the federal level for increases in those programs, and really specifically, honestly, towards our meals programs. That's really where we've been hit the hardest. As you know, inflation has caused all prices to go up. Our meal prices went up for our vendors of 43% over the last 5 years. That's a huge increase, trying to meet that demand while those costs are going up. So those are really the biggest highlights I just wanted to hit on. We do have 2 representatives from the Marathon County Board that sit on our board as well. So Supervisor Lemmer is actually our board chair that sits on our board, and Supervisor Marshall is also on our board as well. And there's been others of you that have served on our boards over the past, but I would entertain any questions that you have for me at this time.
So I'd open it up to board members for any questions. Supervisor Seibert, please.
Thank you, Chairman Gibbs. Is that restaurant program, is that going to become county-wide or counties-wide? Is that just going to be up in the Wausau area, or how's that going to?
Well, it's open to anybody within our region to be able to come to the 60 and older. It's the one that we've developed so far, but we are going to continue to look at other opportunities for congregate dining sites within the Marathon County especially. We have them throughout the region, but definitely need to look at how we can open up congregate dining within Marathon County specifically.
So is that $5 voucher, does that cover the meal, or is that subsidized?
It is subsidized by the Older American Act dollars. So the meal cost definitely is higher than $5. The $5 is a contribution based, and the other funding comes in through funding through our Older Americans Act program dollars.
So what does that cost?
What does it cost? What's the total cost for the meal?
What's the total cost of the meal then?
Total cost for the meal, I think at that program is right around $12.50 a meal.
Okay, thank you.
Sure.
Any other questions? Supervisor Lemmer, please.
Thank you, Mr. Chair. And just to be clear, I don't sit on the board. I'm very active.
Yeah, yes.
But I do want to put a plug in for the ADRC, the Lemmer family. We just lost my dad in December. He died with Parkinson's, and we used several of the ADRC services. And they're things you don't even know you need until you need them, and then you need them. And you probably needed them a lot longer or earlier. And recently in your mailbox, I just picked mine up today, but there was a really important study done by Forward Analytics. They are working with the Wisconsin Counties Association to try and advocate for more dollars coming in from the state and federal level. I think it's very important to remember that our baby boomer population is just aging into this fast. So these are, well, as I look around this room, it's us. It's us that are aging into this population, and it really needs some care. So if you are interested. There's several advocacy days in the spring, and I've gone down to several to talk to our state representatives. I've fired off some letters to our federal representatives. It's a good time to go down to Madison and meet one-on-one with the people that represent us and explain your story to share with them how important the Aging and Disability Resource Center is for our communities.
Thanks, Ann. One thing I'll add just before I leave is that I went to a training recently in regards to ageism, and it's a we. We are aging. One sign that I saw that a county in another state uses to just promote the positivity around aging is that aging is so cool, we're all doing it. And the fact of the matter is that, between now and 2040, the percentage of individuals 60 and older is going to continue to increase. So just things and food for thought to think about. So thank you again for the time to present.
And I might add, aging is better than not continuing to age. So thank you, Mike, and thank you for all the work that you do at the Aging and Disability Resource Center. Next on the agenda is a substance use gap analysis that this board authorized, and we're so fortunate to have with us the health officer, Lori Scudari, and she will be introducing the team that assisted us in developing the gap analysis. So Lori, please, the floor is yours.
All right, thank you very much. Okay, let me pull up the slides. The slides are in your packet. Again, my name is Laura Scuderi. I am the Marathon County Health Officer. Prior to our consultant's presentation tonight on the substance use gap analysis, I wanted to walk everyone through a brief summary about how the analysis came to be. So here's a brief overview of the process, which began when Marathon County received information regarding the opioid settlement funds availability. The Criminal Justice Coordinating Council had several facilitated meetings to determine recommendations and next steps, and they moved forward the recommendation to get a more in-depth review of the gaps within our community as it relates to opioid abatement and mitigation. The Marathon County Board of Supervisors voted to use opioid litigation funds to contract for an analysis of the service gaps for substance use within our community and obtain recommendations for use of opioid settlement funds. Through an RFP process, a consulting firm, Third Horizon Strategies, was chosen. I just want to give everyone a quick reminder that substance use prevention and mitigation strategies are both listed in the county's strategic plan on page 9 as Objective 7.2, mitigate the impacts of drug and alcohol abuse in Marathon County through evidence-based practices, and it is also included in our county's community health improvement plan. So Third Horizon Strategies was chosen for their expertise in the area of substance use, behavioral health, and treatment. They have extensive experience working with governmental entities, and they have experts in the field of behavioral health and data analytics. And with that, I will turn over the presentation to Third Horizon, who have joined us today to review their findings and recommendations, and they will introduce themselves.
You guys can come right up here if you want. Yeah, come on right up here. You guys can scroll. All right, thank you very much. Well, speaking from experience, I am definitely aging. I spent 6 hours in the car today coming from Fargo-Moorhead to visit with you all this evening. I sincerely appreciate Chairman and the board for having us here today to walk through the highlights reel, if you will, for the paper that you all should have access to in your packet. So I'm going to go at a pretty quick clip because we want to make sure that there's plenty of time for some Q&A at the end of this presentation. And joining, my name is Eric Bailey. I'm a Senior Director at Third Horizon Strategies, and I've got my colleague Kayla Allen over here, and then Elvina Faridi back here. So we will all be taking part in answering questions that you may have at the end, so please feel free to save those up and we'll go from there. So if you could go ahead and go to the next slide, Elvina. As Laura said, I'll spare you all the details on the background, but we were hired to conduct a deep dive substance use disorder gap analysis for Marathon County in Wisconsin. So that really was I kind of think about it like popping the hood of an engine and really digging deep and digging around and finding out, are the spark plugs working? Are there hoses that need to be replaced? And it's more than just doing a cursory kind of a look at the engine. It's really getting in there and taking things apart and looking at it. So with that in mind, just to kind of give you a sense of, before I get to the recommendations, which are at the end of this presentation, I want to provide full context for how we got there. So I'll spend a little time talking about some of the national data that we took a look at, and that also included state and county data for Marathon County, but also the contiguous county, and we'll get into that in a moment. So we took a mixed methods approach where we looked at quantitative data, which are the numbers, and then we really spent a lot of time gathering qualitative data. That was really talking to people on the ground who are doing the work in Marathon County to address substance use disorder. And then we'll finish up with our recommendations and open it up for Q&A. So if you go to the next slide. We'll start with the background. You can see kind of a flow chart here of how things went, and this dovetails nicely with what Laura had mentioned. If you could go to the next slide. So some of the core tasks were really, the first piece was really, in full transparency, it's not my favorite part, which is a lot of heads down, digging deep into the publicly available data that's out there. Caleb was instrumental in helping with that. From there, we really started to kind of take a look at some of the insights that we were gleaning from that. And then Elvina was very involved in helping to gather together the qualitative interviews that we conducted throughout this process, which in full transparency was, I thought, the best part of this opportunity was really to get to know people in Marathon County who are doing the work and are proud of what they've done and have accomplished. And definitely were not shy with sharing insights that they had for how things could be better. So if you could go to the next slide. So at a national perspective, roots causes, Laura touched on this a little bit, but the prevalence of SUD in the United States in 2024, 17.8% of U.S. adults, and this is over 45 million, experienced substance use disorder in the past year. So of that, 77% did not receive any kind of treatment. Now, to clarify with that, there are a lot of reasons why people might not get treatment when they have a substance use disorder. And some of that, yes, does have to do with readiness for change and motivation, but a lot of that has to do with not really having systems in place that recognize right person, right time, right location. So a concrete example would be somebody's, just had a traumatic event that's related to either maybe getting a DUI or experiencing an overdose event. If the system isn't there to immediately respond to that, it can be very challenging to keep that person engaged over time. So we'll talk a little bit about that when we get into the qualitative analysis that we conducted. A couple other things on here. You can certainly read this as you go through this, but barriers to care, provider shortages, mental health treatment gap. Mental health's important. It's all part and parcel for working with substance use disorders. We're all holistic beings, right? So, that includes physical health, our mental health and well-being, and that all has to do with how we respond to substance use disorder treatment and issues that we're experiencing. If you could go to the next slide. So quantitative data analysis, as I mentioned earlier, we took a look at it. Think about this in terms of like concentric spheres. So we started with the national, really big spotlight, looking at the national data. Then we came down a bit and took a look at the state level data, and then looked at the contiguous counties. So the counties, not just Marathon County, but the counties surrounding Marathon County, and then Marathon County specifically, because what we really know is that there are national trends that can mirror what's going on at the local level, but this is a very localized issue, and I've done a lot of work around the country, and if there's one thing I've learned is that if I know one community, I know one community. And there are different things that people are grappling with in every single county around. I think what were the 3,500 counties in the country? I didn't know that. That's my trivia for the night. Thank you. So important to know. If you go to the next slide. These are some of the just examples. I won't talk a lot about this, but these are just examples. This is in your packet of places that we went to gather some of the data that I was talking about, whether it was that national lens or drilling all the way down to Marathon County. If you could go to the next slide. So just from an overview perspective, these were some of the things that really kind of wrapped into that overarching look for substance use disorder in the county. So we looked at, think about this in terms of human development over the lifespan, right? So we're going to start with youth. We took a look at youth alcohol use, youth drug use, and then we went into adult alcohol use, adult drug use, youth mental health, adult mental health, and then that last one, that's social drivers of health. Some of you may have heard the term social determinants of health. Maybe some of you have been around enough to know about Maslow's hierarchy of needs. So we're talking about the basics: food, shelter. Do people have access to a decent place to live? Do they have a vocation? Are they gainfully employed? I mean, all of these kinds of things wrap into social drivers of health and have an impact on success with engaging in a system. If you could go to the next slide. So some of the examples of social drivers of health: housing issues, financial issues. Do people have access to health insurance? And then, of course, food. And you can see here, again, this is in your packet. You can look at the numbers when you all have an opportunity of where Marathon County sits within the region, and then with respect to both the state and national. If you could go to the next slide. Let's start with alcohol use with youth. So you can see here, again, this is all color-coded. So within Marathon County, you can see how things have been trending since 2015. So if you look from left to right. So youth who identified that they had drank alcohol before the age of 13. I don't know about you all. I have two young women who are now off on their own, but I've navigated these waters, and it's tough. But just to think about that for a second, before the age of 13, having that first experience with alcohol, and look at how much that jumped up from 2017 to 2019. And these are attestation from youth who would respond to the survey. Went down a little bit in 2021, but still alarming in terms of when that really starts. And if you look at that in context with where Wisconsin is and where the United States is, it's definitely higher, right? So that's one thing I wanted to point out. And if you look at binge drinking trends, you can see too there that from a trend perspective, it's gone down a bit, and it's about commensurate with where things sit with the state, but lower than where things are at the national level. So if you go to the next slide. Drug use with youth, you can see here there are a couple things that we looked at. Ever used prescription drugs without a prescription, so that would be illicit drugs, or illicit opioids, for instance, which we have all heard the horror stories about fentanyl being cut into the illicit drug supply and how deadly that can be. Have you ever used marijuana? Again, I won't spend a lot of time talking about all of the differences. You can all look at this in your packet. If you go to the next slide. Next couple of slides have to do with adult, the same kind of look with the binge drinking, excessive drinking, self-reported. I want to talk about this alcohol-related mortality. This one was actually caught me by, it was a moment of pause when I saw this. And so alcohol-related mortality, these are alcohol-related deaths, right? So what's interesting, I want to make a distinction between opioids and alcohol. Opioids, we know, fentanyl, you can overdose, and that's it. If there's not an intervention, it's a quick death. It's deadly. The stakes are really high. Alcohol is a slow burn. It has a significant impact on the body over an extended period of time. That's one way to look at it from a health perspective, but certainly motor vehicle accidents and other kinds of things that can happen as a result of alcohol, that all fits within that bucket. And look at where Marathon County sits. So that's something that, quite a bit higher than where it is with the state, the contiguous counties, and then at the national level. If you could go to the next slide. Similar, one thing I want to point out with the drug use with adults, if you look at this is a little bit hard to see on this, but you can see it in your packet with the one in the top left-hand corner with the rate of opioid deaths. You can see that for Marathon County, which is that blue line, there's been a steady trend upward since 2020, which actually is fairly consistent with where we saw things at the national level since 2020. But things plateaued a little bit at the national level, but there's still a trend upward for Marathon County. So that's something to keep in mind, and with respect to where we'll come with the recommendations. If you could go to the next slide. As I'd mentioned, substance use disorders don't occur in a vacuum. You know, we are holistic beings. Our mental health impacts what we do to try and cope with some of those things, whether it's depression or stress or other kinds of things that are going on. And you can see here that when it gets really bad and people are considering suicide or even get to the point where they attempt suicide, you can see some of the rates here. And Marathon County sits a little bit behind where things are at with the state level, and the national level is a little bit higher. Again, keeping in context of where things sit across the entire country. If you could go to the next slide. Mental health with adults, you can see this one on the left is interesting. Poor self-reported mental health is just an overarching sense of malaise or not feeling good, not feeling well with mental health. And that can be a low-grade depression. It can mean things that are a little bit more severe than that. But this has a connotation that my mental health is not good, and this is what people are reporting. For Marathon County, again, that sits about even with the state, a little bit below where it is with the contiguous counties, and then a little bit below where it is with the United States. So if you could go to the next slide. From a key takeaway perspective, I won't get into granular details with this, but I want to point a couple of things out. Again, with the youth alcohol use, high school-aged youth in Marathon County showed higher rates of alcohol consumption before the age of 13 compared to the state and national averages, but lower rates than of marijuana and non-prescription medication use. So going down a couple of ribbons here, opioid-related emergency department visits. While emergency department visits for opioid-related issues were lower per capita in Marathon County compared to the state, the county saw a dramatic 100% increase in such visits from 2018 to 2022. So that was relatively dramatic. If you could go to the next slide. So let's talk a little bit about the qualitative. This was the part that, as I mentioned, was so very fulfilling to get to know folks in your county who are working with these issues on the ground. We had 14 key informant interviews to better understand the current landscape. And Laura had helped us connect with the individuals that we interviewed, and then we had some ideas of our own as well. This ranged anywhere from a person with lived experience, so someone who's actually experienced an issue with substance use disorder and experienced the system and the way that Marathon County responded to that person, anywhere from that all the way up to talking to the school district leadership, folks from the healthcare centers, folks from social services. So it was a wide range of people that we talked to that were able to let us know how things were going. Again, what's going well and what's not going so well. And they didn't hold back. So some of the areas of success and ongoing initiatives you can see here, and I won't get into granular details with this, but these are some of the things that came up a number of times with a number of folks that we talked to with the key informant interviews. So these are things to be celebrated, going very well in Marathon County. If you could go to the next slide. So some of the key themes that really came up, there are a couple of slides here, and I'll hit some of the highlights. So service gaps and barriers to care. So, even though there are three major resources in Marathon County that relies on for substance use disorder treatment, participants described notable gaps that we also determined through quantitative data analysis, indicating insufficient access to treatment. One example would be, and we'll talk about this in the recommendations, withdrawal management, or the older sort of steeped in stigma term is detox or detoxification. So there are different ways to approach that, and one of them is to have somebody go to a hospital bed, because it can be deadly at times to go through withdrawal depending on the drug that someone is experiencing withdrawal from. All the way down to something that is more, it's monitored, but it doesn't necessarily need to be in a hospital setting. So it could be in a lesser restrictive kind of a setting, and not taking a hospital bed away from somebody who needs it for a physical health condition. So the American Society for Addictions Medicine has a way of kind of mapping that out depending on how restrictive of care it is for those individuals. And then they put the way that it has, they have a number system. And if it has a 0.7 along with the number, then that means that there's some kind of medical monitoring that happens during that time. So what we found was that there are no withdrawal management programs that kind of fit that bill, that aren't all the way up to that hospital bed, that are kind of in a lesser restrictive setting. So we'll talk about that in the recommendations portion. We also talked about workforce and staffing. Next slide. You can see, cross systems collaboration. There's definitely a collaboration that's going on within the entities that are servicing this population in Marathon County. But the individuals that we spoke with were some of the first to say it can be better, it can be improved. And then local norms and community-based insights, there were some things that came out of that too that just had to do with the culture of the county. And what's interesting, and I mentioned that I drove here from Fargo-Moorhead, so I live in Clay County, Minnesota, which is west central Minnesota. And when I speak with our public health entities, they're like, yeah, Eric, we understand opioids are an issue, but methamphetamine never went away. So methamphetamine is still very much an issue, and unfortunately fentanyl is cut into all of the drug supply. So whether or not people want to use opioids or not, they're getting it if they're using methamphetamine, and that's just the reality of it. So that, in addition to alcohol, a culture of excessive drinking, a culture of alcohol, again, over time, slow burn, it can really erode away at someone's physical health. If you go to the next slide, there are some disproportionately impacted populations that, for whatever reason, people that have experienced trauma can be more susceptible to some of the issues that happen with SUD. And if there's not a way for the system to respond to that appropriately, that can lead to some issues. The social drivers of health that I mentioned, certainly when people are struggling to put food on the table, or they're having a hard time making rent, or having a hard time keeping their home, again, those things tend to take precedence over dealing with mental health and substance use disorders. And it's that Maslow's hierarchy of needs, trying to just take care of the basic needs to at the expense sometimes of mental health and well-being. So then you can see other areas of improvement too, and we'll talk about that as we get into the recommendations. If you could go to the next slide. So here are the punchlines. And this is all in your packet. And I will say again, this is the highlights reel, right? So there's a more comprehensive paper that we pulled together for all of you to take a look at and read in more detail. So how we divided things up, and this is something for the County Board of Supervisors to consider with respect to the opioid abatement funding, that you are all will play a role in helping figure out where those dollars will go. We came up with some near-term recommendations. So these are kind of some of those low-hanging fruit things that you may consider. And then some more longer-term recommendations that may not be something that would take precedence over the near term, but they're definitely something to keep in mind as you build a recovery-oriented community going forward. So I'll hit each of these as we go through the slides. If you go to the next slide, Alvina. So near-term recommendation number one, enhance the ability or availability of non-medical detox specialty services. And when I say non-medical, it's not that there's not a medical component to it. It's just outside of the hospital setting. So these are withdrawal management centers that are really designed for, people can go there, whether it's from a law enforcement intervention, public safety, social workers, individuals who can go there on their own accord voluntarily. So this definitely plays a role in helping to ratchet down how often those beds are used for this specific purpose. If you can get those individuals into the right time, right place, right location, that can make a huge difference in helping get them hooked and ready to engage in treatment with the people who really know substance use disorder. Near-term recommendation number 2, enhancing the availability of medication-assisted treatment. So another term for this is medications for opioid use disorder. But I need to add that there are very effective medications for the treatment of alcohol use disorder as well. And amazingly, one of them is naltrexone, which is also used for opioid use disorder. It's significantly underutilized, but if that's something that can be used within the context of treatment for alcohol use disorder, that can be very helpful. For Marathon County, there are some interesting dynamics. So there are 2 medications that you probably have heard of. One of them is buprenorphine or Suboxone. So that is a medication that can actually be given in an office-based treatment setting by any DEA licensed physician who is able to prescribe narcotic medications. It can be a very effective medication for the treatment of opioid use disorder. And then there's methadone. So methadone is something that's been around for years, and is something that actually has to be prescribed at a federally licensed facility. So the interesting thing about methadone, it's very effective, particularly with some of the more advanced fentanyl analogs that are being cut into the drug supply. It interacts with the brain a little bit differently than Suboxone, so it tends to be a little bit more successful in really hitting the brain chemistry that level of fentanyl is engaging individuals who struggle with this. So one of the things about methadone is it has to be taken at the facility, right? So one of the things that becomes a barrier for people is transportation, or if they're trying to get to the methadone maintenance program to take their medication, it impacts the child care and the ability to get to the job on time. And it actually gets to a point where people are like, well, I can't do it. I can't make this work. So one of the things that can help with that is to have mobile methadone maintenance, and that's a mobile van that can go to different stretches of Marathon County is big. I drove in here today. It's like, I came in from the west. It was 30 miles until I got to Wausau, and then there's another 30 miles to the east. So that's a big county. That's a lot of ground to cover. So for individuals to have to go to the one opioid treatment program that can, that's a federally licensed program, there's one in Wausau. So again, this is a big county. So for those that would benefit from methadone, may have a challenging time getting in to actually take that very effective medication. So that's one thing to consider. If you go to the next slide, recommendation number 3, enhance the availability of culturally specific services, including those who speak English as a second language. There were a couple of organizations that we met with that are already doing some incredible work engaging individuals who speak English as a second language, Spanish speaking in the Hmong community in particular. So by thinking about how those organizations can be supported in doing the work that they do to help individuals with those communities get connected to services could be incredibly helpful. If you go to the next slide. Promoting school-based prevention. As I mentioned, it's startling to know that there are youth under the age of 13 that are starting to drink. So having some opportunities to address that in a school-based setting, there's a captive audience that not only includes the students, but then their families as well, to have some of those opportunities to talk about some of the dangers of alcohol and drug consumption. That's one piece, but another piece is talking about how do you manage these big feelings that you're experiencing as a young person in a way that's healthy and productive, and that is going to complement your mental health and well-being in a way that substances will never be able to fully address. If you go to the next slide. The next two I'll just spend a couple of minutes talking about. So they're sort of connected, but On my drive here, I listened to a podcast, and there's a gentleman who is fairly well known. He's run Medicaid programs and some things at the federal government. And one of the things that he said that really stuck with me was that, because one of the questions that someone asked, if you were appointed, the health czar, how would you manage the issues that we're experiencing? He said, well, I would never be a czar. I would be a convener, because this is about being at a table with people who are making, these decisions about the health and well-being of our communities. This is no different. So formulating a countywide SUD response advisory committee, these are people that are doing the work, that have had lived experience, that are at the table contributing to that conversation on an ongoing basis to say, hey, these are the things that are broken. These are the things that we think could help repair these issues that we're experiencing. And then here are some ideas for how we can get there. If you go to the next slide. So this is financing a public health support position that's focused on substance use disorder. This could be an individual that helps with that convening of that particular group of individuals. It's in essence the glue, that person that can show up at meetings, be an advocate, understand how SUD impacts the community in a way that a lot of individuals just simply don't have that depth and breadth of experience. If you could go to the next slide. Longer term recommendations, as I mentioned, I won't spend a ton of time on this, but enhancing the availability of recovery supportive housing. So recovery supportive housing is interesting. It's not residential treatment. I want to make that very clear. Recovery supportive housing is a place where people can live long-term that support their efforts to sustain long-term recovery over a long time. This is not something that you go in, put a Band-Aid on, and the scab heals and you're done. This is a disease. This is something that can progress in a way that's not dissimilar to a lot of other chronic conditions. So having that longitudinal opportunity to engage in a living environment that's supportive of people's efforts is very important for some people. So we did notice that in our interviews and the data that there is a lack of availability for recovery supportive housing. So that's one thing to keep on the radar. The next one that we came up with kind of ties back to what we mentioned about development of workforce. So workforce is an issue that transcends healthcare and SUD and everything. I mean, there are probably people in this room that have been directly impacted by workforce, and that can lead to having a very difficult time doing business. For instance, not being able to get enough employees to keep the lights on. So SUD treatment, behavioral health, mental health, nursing shortages, this is all part of that. So there were some recommendations that we came up for consideration in the long term to perhaps partner with some of the institutions that, like University of Wisconsin Stevens Point, that do have programs that are helping people get into these professions that are helping people with substance use disorders over time. They can do things like offset the cost of tuition if they agree to work in a certain location for a period of time. And there could be ways to do that within Marathon County. If you could go to the next slide. So in conclusion, I won't read this verbatim. You can certainly read this, but I would say that number one, your county is doing some incredible things, and the way that the community has rallied and come together to address a variety of issues with those that struggle with substance use disorder was truly inspiring when we conducted the qualitative interviews. But there's also a lot of room for growth, and there's a windfall opportunity, if you will, with this opioid abatement funding that is being funneled into the county governments across the country. And Marathon County is just one of 3,500 counties that are receiving dollars to help address this. So it may not seem like a lot of money, but being fiscally responsible to the point where you're very strategic about where these dollars go, I mean, that's really up to you as a board to determine, how can we make the most? How can we get the most bang for our buck? Listening to the voices of the community to move forward and help with this. With that, I will go ahead and open it up for some questions. And you're probably all tired of hearing my voice. So Alvina and Caleb, we'll probably have them jump in a little bit here too, but please, if we could open it up for some questions.
If we can open it up for questions. Questions from the board? Supervisor Robinson, please.
So have we calculated the cost of opioid abuse in the county? And if we have you or are you aware of metrics that are applied to your recommendations that would reduce, how do we create dashboards to evaluate the effectiveness of the various programs that we leverage? So are there some good best management practices relative to that?
Yeah, in short response to your question, we can certainly get back to you on this. We didn't do a deeper dive into the specific dollar amounts for the impact of opioids on Marathon County. That data, it's tricky because there are multifaceted aspects of all of this that go into how does it impact total cost of care. You can get some of that from health insurers or the health department that is keeping track of some of that data. But the metrics, that's a great question. And part of it is partnering with those types of organizations to set up a dashboard. And this gets back to that board, of individuals that could include somebody from the predominant health insurer in the region. It could include someone from public health. It could include somebody from Medicaid, that understand what kind of an impact anything that you would do on the ground would have on some of those, those numbers.
Supervisor Sandalski, please.
Thank you, Chair. Have you ever looked into any like the long-term sober living facilities at all? To see, there's a couple. I know the one Gospel TLC up here in Wausau. It's kind of relatively newer. It's about 2 years old now. Mm-hmm. Have you ever looked into any like sober living in your experience?
Yeah, we did. We took a little bit. We didn't do a deep dive into some of the services that are available that are providing sober living. And I'll tell you, one of the things that's challenging is actually identifying them because they operate in different ways. I mean, some of them will be actually run by faith-based community, for instance, or there may be other entities that we just wouldn't have run across in our research. It doesn't mean they're not out there, but there are some national organizations that are like quality standards, because one of the concerns has been that for sober living facilities, that they're not setting up a scenario where there's some fraud, waste, or abuse that's going on in those facilities. So going that direction, I would just caution you to make sure that any kind of a sober living facility that's up and operating, to make sure that you understand what the rules of the road are for operating a sober living facility by the state, and then what are some of the best practices at the national level, which are out there. There's a National Association for Recovery Residences, for instance, and there are some great models too that can be leveraged when thinking about that.
Next, we have Supervisor Lemmer, please.
Thank you, Mr. Chair. I'm not sure who this question is directed to because it's probably out of your scope, but if memory serves, when we had our joint Health and Human Services and Board of Health meeting, maybe it was chatter after, or maybe it was during, alcohol seems to be the bigger issue in Marathon County than opioids. Not 100% sure, where that comes from in my mind, but can the opioid settlement dollars be used for alcohol detox?
Not directly, but I will tell you that the system is so intertwined. So it's kind of like what's the saying? The high tide raises all boats. So if there's an effort to leverage the opioid abatement funding in a way that recognizes that the facilities that are helping people with either drug abuse, opioids, are also treating people with alcohol use disorder. And what you'll find is that the majority of people with opioid use disorder have a polysubstance use disorder that includes alcohol. One exception to that I can think of specifically is the opioid treatment programs. The OTPs are really like methadone maintenance. That's very specific. But some of the more broader kind of brushstrokes that you can make, that's something definitely for the board to consider when you're making some of these investments.
Supervisor Crivelli, please.
Thank you, Mr. Chair, and thank you for the presentation. And this might be a question for Alvina. You talked about the right person, right time, right location. When you did your qualitative data analysis, did you take a look at how many people would be willing and voluntarily go into treatment programs?
If you mean talking to people with lived experience, wanting to go towards that route, am I understanding that correctly? Not in particular, but the reason we wanted to incorporate that voice from lived experience in the community is to understand that. And so a lot of the things that we did look at or did find was looking at folks that in communities where there is still stigma around it. There's a lot of work that's being done in the community to destigmatize seeking help and reaching out for help. But one of the barriers certainly that we did notice that may impact people reaching out for help is stigmatization. But aside from that, we've done a thorough analysis of all different types of behaviors. So we really need to also hone in on what are some of these social determinants of health, as Eric mentioned. Some folks even mentioned lack of childcare to be a barrier for them to even go out and seek help, lack of recovery housing, long-term recovery housing. So if we think about it from that broader lens, there's so many different points and avenues that came across for us to kind of consider that what are some of these barriers that may be impacting folks from seeking out help.
The one thing I would add to, and I think I actually brought this up earlier, that of the 77% of people that didn't receive treatment, there are a certain percentage that aren't interested in treatment.
Yeah.
Right? There's a readiness for change. But you know what's interesting is that using diabetes as an example, how many people diagnosed with diabetes are jumping up and down saying, I'm ready for treatment right after the initial diagnosis? It's about the same as substance use disorder. So, it just put that into perspective that readiness for change is definitely a component, and that's really hard to track because, actually identifying people in that particular cohort is extremely challenging. But all the things Alvina said were absolutely spot on. The one thing I would add to that too, culturally sensitive treatment, when we talk to the individual from the Hmong Community Center, and then also from the OLA, there are certain ways that systems are set up that sometimes aren't appealing is not the right word, but just there's a lack of trust. Mm-hmm. When there isn't somebody in my own community who that's a familiar face, it makes it difficult to walk into the door for treatment for the first time, or even to open up that conversation in the first place.
And I'll add one more point to that too. Eric talked about readiness for change. On the flip side, it's also, folks maybe not knowing what exists in terms of treatment and services. So we looked at local initiatives and chapters like NAMI and those types of initiatives. Again, those very crucial community-based initiatives can help us not only spread this information, but also even encourage people from different communities to come out and, get at that point where they are ready for that change.
Next is Vice Chair Dickinson. Vice Chair Dickinson, please.
Thank you, Mr. Chair. One question I have is, did you ever speak with veterans, the Veterans Service Office? Were they part of one of these affected groups that were part of the analysis, yes or no?
No, we did not. And thank you for bringing that up. That was definitely a gap on our part.
Okay, I do have another comment, and that kind of piggyback on Supervisor Lemmer's comment. So, we had these funds for this opioid settlement, and I have a concern that this analysis went very deep into a lot of other areas that aren't really opioid related. It was just mentioned childcare, housing, health insurance, food, diverse populations, schools. It really seems to expand from the focus of the settlement and the comment about leveraging or not, directly using those funds or indirectly using those funds is a concern. Thank you.
Okay, next we have Supervisor Gisselman, please.
Thank you very much. So what's next? Maybe the question for administration, now that we have this excellent document in front of us, now it's up to the Marathon County Board to decide what we're going to do with it. Is this landing in some standing committee of the county board, or how are we approaching this this document? I think this is quite revealing, quite historic. I think that this is coming to this board, and now I look forward movement with regard to Marathon County government and to how we proceed. Thank you.
So I'll start. Short answer to your question, I think, is it's yet to be seen how the board is going to go through the process, what process you're going to use to ultimately allocate the funds. But I can say that this was discussed at the executive committee, that very question, what is next? What does that process look like? I would say, this is my characterization of that meeting, there wasn't any clear direction to staff as to, hey, this is what we want you to do next. The conversation, though, was very helpful. And in fact, we had a meeting this morning of the Criminal Justice Coordinating Council Executive Committee, and we brought up that what is next. And in fact, during the Executive Committee, there was discussion, question, I believe, or a comment by Vice Chair Dickinson, relative perhaps to the idea that we would allocate funds not based on specific tasks, but rather by either department or what I interpreted kind of subject matter area, like harm reduction, law enforcement, treatment, which sparked some thoughts on my end. And I think from my perspective, what I'm endeavoring to do is I'm going to sit with the Criminal Justice Coordinating Council and advocate that we form a work group to kind of look at what might be a suggestion we as staff can make, looking at this report and also looking at some already existing work that the state of Wisconsin did. In fact, Vice Chair Dickinson's questions made me recall that in 2014, the State Council on Alcohol and Other Drug Abuse issued a report on heroin in Wisconsin and how to intervene. And the reason I remembered that is I was part of that and one of the authors. So I think pulling some of those resources with this report, we can sit down, and I really do think the idea of, to the Vice Chair's point, making sure we align the funding with what is permitted under the opioid settlement is vitally important. But also having a plan for, you're going to have $3 million-ish that you're going to get, provided all the settlements come through, over 18 years or the next 15 years now. How quickly do you want to expend those funds? My sense is you want to make them last a fairly long time, but also you don't want to sit on them forever either. It's kind of like the discussion you've all had with your American Rescue Plan Act funds. So at the CJCC, I hope we can form a work group. I hope the board views that as time well spent to have that group of professionals sit down and come up with a proposed strategy. But I did think the executive committee conversation was a fruitful one, just talking through what that process ultimately is going to be, because it does touch, as was alluded to in the presentation, it touches a lot of different spheres. You'll have your certainly public safety, talking about law enforcement, health and human services, talking about our impact on our treatment providers, North Central Healthcare, social services, as the vice chair just referenced, veterans, and then also thinking more broadly, workforce was alluded to, which implicates the Extension, Education, Economic Development Committee. So a lot of committees could be involved, which logically makes me think that some coordination through the executive committee is long-term, a nice way to kind of lead where you want that discussion and process to go. But certainly, one thing that resonated with me also was a comment that was made by Supervisor Morash at the joint meeting. A lot of the recommendations that Eric and the team put together were a lot of the things that the CJCC thought, which is good because you have a lot of professionals on the CJCC. I sit on that as well. We had our thoughts as to where our gaps were, but we recognize the value of having an outside set of eyes and to fact check us, because you hate to be 3 years from now and find out that, hey, we thought we were heading in the right direction, and it turns out our plan wasn't sound. So we did go through this exercise, which I think, as were some of your comments, I think it's valuable, but that's the long way of answering your question, Supervisor, that I think you still need to define what the process is going to be to allocate the funds. As I'll talk about in a minute, your 2025 budget does not allocate any.
Okay, any other questions? All right, I want to thank you specifically for the great presentation, the great work that you've done. And now the board's challenges is, as alluded to, is to come up with the plan on how to implement and where to utilize those funds as we move forward. So our next item on the agenda is item 8D1, Administrator's Presentation on the Proposed 2025 Budget and Capital Improvement Plans. And also just a plug that the agenda does have the link to the budget presentation that was presented to the HR Finance Committee, but I'll turn it over to Administrator Leonard, please.
Thank you, Mr. Chair. Thank you, members of the County Board. Certainly was a pleasure to deliver the budget presentation that is linked in your packet or in your agenda to the HR Finance and Property Committee for the 2025 annual budget and the capital funding plan. I will begin by allaying your fears. I am not going to present the entire hour and a half presentation. I'll be exceedingly brief, I hope. And then Committee Chair Robinson can talk through the item number 2. I just wanted to open with a couple of comments. First, I want to give a very strong thank you to staff. The budget, as always, is a team sport. Sam, our new finance director, and her staff did an exceptional job. She joined us right in the middle of audit and then dove into budget. She's doing an exceptional job, as is her team. Molly Adzik and our team from HR very much appreciate their efforts. All of the department heads, I know the budget time for them is a hard time because I always give them an unenviable task, which is, hey, I don't have much more money or any new money. Do all the same great things that some of which you just heard about in the presentation with your existing budget resources. So department heads did exceedingly well. Deputy Administrator Holman led our capital planning work. If you've already looked at the budget, and I trust all of you have, you'll see a couple of differences. Our data officer, Michael Schultz, did an exceptional job, I think, adding additional context to the budget with her work. And of course, last but certainly not least, Sarah Severson, our communications person. If you take a look back to budgets just a couple of years ago and compare them to what you see before you today, a lot of that is entirely her doing. She does a great job. She managed a lot of the logistics across this entire budget. So with that, couple of key takeaways. I said I delivered the budget to HR Finance, and I did, but this is your budget. It was your budget before I delivered it, because one theme, again, is that the development of the budget was guided by the county board and all of your standing committees through our new process, which I am very thankful for, because it does give me direction, as opposed to, hey, go build a budget, and then I bring you something that perhaps you never wanted. It's the Christmas gift that keeps on giving. But this truly is your budget. It was guided by your standing committees, and just a couple of examples of what that is. Your budget priorities that you identified, budget priorities and assumptions you identified in June and July. Your budget priorities, no new borrowing in the budget. There is no new borrowing in the budget. Your budget priority, no new positions that are levy funded. There are no new positions that are levy funded in the budget. All of the positions that are funded through the budget went through that process under your ordinances. Your budget assumptions, you gave me revenue and expense assumptions to work with. A conservative sales tax estimate, more than 8% below the Ford Analytics projection, and you have good reason to do that. You gave me a 3% compensation expense assumption. 3% is in the budget for compensation. I think that is vitally important, by the way. If you have any questions, I'd be happy to talk more about that. And then you challenged staff to evaluate revenue opportunities, which we did. The portion of your budget, we added appendixes this year to, again, add further context. All of your fees, the county fees for services, are in those appendices. So in addition, you gave us a rolling stock amended policy last year. We funded your, the budget, I should say, funds in accordance with that rolling stock change in policy. Your routine and end-of-life maintenance directive. Your directive has been fix all those things that are routine maintenance and end-of-life. I'd love to tell you we funded everything. We didn't, but we got really close. And I'm very proud of that capital plan. So we've brought you a budget. I presented to HR Finance, and they made one amendment, and it's now out for publication. But the budget is largely what you asked for in terms of at least what I heard you ask for through the process. That said, it's status quo. I said that a number of times in my presentation to HR Finance. There isn't a whole lot of new in the budget, and the new that is new is relatively small in dollar amount. There are a couple new programs and services at the health department, some expanded beach water testing, some work that we're doing as a subrecipient contractor for the city relative to lead mitigation that aligns very well with our existing programming. But largely, it's a status quo. That may be uninspiring, but it shouldn't be. You have a long history of very strong budgets. I put in my opening comments in the budget, Marathon County is in a very good place. If you look at our peers in north central Wisconsin, you see we are doing very well relative to our tax rate, relative to our per capita expenditures. That's on page 5 of the budget. I think that speaks volumes for the direction that this board has provided to staff for a lot longer than I've been here. And that's kudos to you as elected officials. We are far below our peers in north central Wisconsin relative to per capita expenditures and per capita tax levy. That said, we deliver exceptional services here. In talking with my peers, that is often the case. They, hey, what are you guys, how do you do that? That's, again, kudos to you for providing the direction and setting very high expectations. And I couldn't be more proud of staff for really following through on those. So I said I'd be brief. Happy to answer any questions about the budget, and certainly the work is not done. You all know Chair Robinson sent out Committee Chair Robinson sent out an email kind of laying out what those next steps are relative to consideration of the budget, the opportunity for all of you to offer amendments to the budget. Your public hearing is scheduled for November 1st at 3 p.m. It'll afford you the opportunity to hear from the public. You'll have more time again to consider amendments. At this point, of course, the budget by statute is frozen until such time as it's before the board in November, and November 12th is your ultimate hearing on the budget. But not only has the board had the opportunity to shape and meld the budget up until this point, my closing points is those, you still have time. If you have any questions and you want to have assistance in preparing a budget amendment, we do have a budget template that staff have worked to ensure that first and foremost, the budget remains balanced, because that is a requirement. So we have Sam, the finance director, Corporation Counsel Purner, and myself are willing and able to sit down and assist you in any budget amendment efforts you might have. But that's all I have, Mr. Chair, unless there are specific questions or if Committee Chair Robinson wants to add anything.
Any questions directly for the administrator now?
I should say, I mean, you probably want a number. The tax rate went down in the budget adopted by and published by HR Finance, just slightly over 5%. So your rate has dropped significantly again this year. That's actually a larger drop than you had last year.
Supervisor Robinson?
Lance mentioned the public hearing that's coming up, but we accepted the budget, so now the budget is actually the county boards, and we'll be working on it through its adoption on November 12th. But I would encourage all the committees to look at those aspects of the budget that fall within your jurisdiction and develop any recommendations or changes that you'd like to see, but please use that form. The Finance Committee, or Human Resources, Finance, and Property will be meeting next Tuesday. We'll be focusing in on the KIP. We'll be also looking at the whole issue of ARPA reconciliation because we have to obligate those dollars by the end of the year. And we're trying to look at not only next year's KIP, but also a 5-year lookout for a longer term plan. But there are opportunities for the committees. But again, the public hearing is on November 1st at 3. We were trying to schedule that in a window. The budget came to us later this year because we continue to have some workday implementation issues that delayed its presentation. The same thing that the city is experiencing. I want to commend the administrator and our staff for bringing it in. Hopefully next year we'll have it earlier and have a little bit more time to look at it at committee level. But part of that is a result of our changing of our underlying package, computer software and packages. But the important dates are, if you have an amendment, we would ask that you turn them in by November 8th so that they can be reviewed by staff and then considered by finance. But ultimately, the final arbitrator on any amendments is the county board, and that will occur on the 12th of November.
I guess I'd be remiss if I didn't express my sincere thank you to administration and to staff for developing the budget and the hard work that they did. One thing that the administrator did allude to was in the development of this budget and the presentation that we just had a little earlier, none of the opioid funding was allocated in this budget, and so nothing is, so again, it's up to this board to develop that plan as we move forward. Vice Chair Dickinson, please.
Thank you, Mr. Chair. I had 2 questions. One is related to Amendment 1 with the new economic development position, and how I'd like to know how that relates to our budget priorities that state there would be no new positions funded with the tax levy, and it seems that is the case because there is no indication in our budget priority about casual or full-time employee or whatever. Second question that I would also ask is, it looks like the Veterans Services budget has been cut by about 1.2%, 3.7% on the levy, and I'm wondering why that is when appointments have increased over the past couple of years. Thank you.
Administrator Leonard, please.
Sure. On the first question, I think I'd leave that to the authors of the amendment. That was an amendment made at the HR Finance after the budget was adopted. I did allude in my budget message, I can find the page, but I did not provide any funding for those economic development activities. It's relative to the funding, it was put into the casual employee line item within county administration. That said, I hesitate to call it a position because it's not a full-time equivalent allocated position. It was funding, as I understand it, through the amendment for a purpose. With respect to veterans, I can look into that. I don't believe that we made any fundamental changes to that budget. The only, and I can, if you give me a couple minutes, I can certainly get that answer before the end of this meeting. But there weren't any fundamental reductions. It could be simply an allocation issue that we had within the budget, but we'll we'll get you that answer, because I certainly appreciate your point.
Okay, Supervisor Marshall, please.
Thank you, Mr. Chair. As I look under the annual budget that is on the website, what was published to the public has a tax levy increase of 3.27%. So the Amendment 1 increased, I believe that your budget was a 2.8%. So just want everyone to know that what the administrator, the budget did not include what has been published to the public. And the mill rate is down 5%. So the tax levy is going up 3.27 according to what was published. Is that correct, Administrator?
I don't have the percent of tax levy going up. I believe the tax rate is down 5.01%, but you're absolutely right. The effect of the amendment essentially was to add 157,000 and some change to the levy. I can calculate you said it was 3.27 was the.
That's what's published. It's right underneath your budget on the website.
Okay, Supervisor Lemmer.
Thank you, Mr. Chair. I'm confused by part of the presentation we had at the HRFP meeting on the 9th of October. We had the counter book from the tax delinquent properties, and there was a summary page. I don't know what page in the packet, but it had a report that was summarizing the debt from 2010, 2011, all the way through 2024 that is outstanding in taxes. And we cannot collect money from more than 10 years past 11 years. Okay, so we've already then, according to what was in the packet, written off, not quite $100,000. Where does that money come from? Because we have to buy that debt to all the municipalities, right? Is that budgeted somewhere?
Supervisor Robinson?
I'll give you a little bit more of a longer, an answer, and then Administrator Leonard can correct me. But every year when tax bills go out, people have 2-3 options or different payment schedules. And if they're not paid by that July deadline, the county basically buys or pays the other taxing entities what they would have received. So we basically assume all responsibility for delinquent taxes. That includes special assessments that may be levied against parcels for utility improvements, not mowing their lawn, or whatever the reason. So that comes out, and we basically write. We have that as an account receivable. So it's carried into our budget. If we didn't have that, we would have a higher reserve amount. So in looking at that counter book, I think it was $98,000 was written off in 2010, 2011, 2012, plus 18% interest per year. So we basically would have funded the position that we're looking at, but we're not, I think we're trying to deal with a long-standing problem relative to tax delinquent parcels. And we've been looking at, over the last couple of years, how do we change that process to make it easier? And we went from the traditional tax foreclosure through Chapter 75 of the statutes to look at the MREM process. The administrator was very helpful in that, as well as Corporation Counsel, the treasurer, the clerk, and others. So we've been trying to look at how can we reduce that backlog, and I think we may be higher than a number of other counties. So we're looking at how do we do that. Once we take that title, we We then shift from the treasurer's office to the clerk's office, and then she looks at it from the perspective of how do we deal with disposing of that property. But the committee's also been looking at how do we deal with our surplus property that we may have acquired and not have a use for. One of the things we'd like to have that position look at is how do we manage those surplus properties? How do we best manage those delinquent properties that we've taken title to? And my thought is that this is probably a heavy investment up front, and it will, once we get caught up, it will not require as much support going forward, which is why the approach was to do it to the casual employee. Supervisor Marash and the Extension Education Economic Development Committee has been looking at the role of the county relative to using our property for economic development, and she can speak to that, but we've also been talking about what do we do from a housing perspective. But we're trying to deal with that backlog and trying to get caught up, take those properties, get them back on the tax roll, generating money, so we will get rid of our obligations, or that accounts receivable, and then generate additional revenue through getting those back in the tax roll. It's been somewhat our process of disposing of it once we take title to it has been challenged a little bit by recent Supreme Court case out of Hennepin, Minnesota, where if we take title and we sell it and we make a profit, it's a takings. And the Wisconsin legislature has also passed legislation limiting what we can do, and we would have to share with the former property owners any money above what we have spent in back taxes, our cost to take that property. Those are all reasons why we have a need for someone to come in and sort of jumpstart that process and look at it. And Supervisor Marash can talk about it from the perspective of redeveloping those parcels.
Yes, thank you. From the EED committee, we, at the beginning of our term, identified key priorities we wanted to work on, and one of them was addressing affordable housing. We have Objective 10.6 in the strategic plan, which is to ensure the future and availability of a skilled and flexible workforce prepared to meet the needs of both existing and emerging industries and technologies. Strategy D being to develop policies that promote a variety of safe and affordable housing options to enhance workforce availability. So this budget amendment aims to provide a specific funding mechanism to support those economic development activities. So having a dedicated staff position to carry out these initiatives would expedite our ability to clean up our tax rolls, as well as find the best solutions on how to move forward with our county-owned properties. Our goal is to have this be limited, maybe even 1 year if we can get this cleaned up. It would be great if we had a person that could work with the rural municipalities to find out if there was anything.
Mr. Chair, can I make a point of order? We're not discussing that. That's on this. That's a different agenda item. I think we were discussing, my question related to
part of the budget,
the funding of the
part of the budget
funding as
development.
related. Okay, fair enough. Thank you.
Thank you.
I thought I was answering his question. So if I'm not answering your question, if you have a different one, Supervisor Dickinson, I'd be happy to try to answer that.
If I may, Mr. Chair, I will answer her question if you like. My question was not about the detailed specifics of the position, but whether the position related to fit within our budget priority R2924. That was my question, not about the specifics. We could do that later.
All right. So other questions? Go ahead.
There was
Administrator Leonard, please.
Thank you. To Vice Chair Dickinson's first question, thank you for the time. Within the veterans budget, we budgeted for retirement, so there's filling the next position at a lower cost was one of the reasons. And then also we had an increase in grant. So those two things together caused a slight reduction in the levy allocation that was necessary to fund the department, but again, no cuts in services. With respect to the specific question about where are the write-offs in the budget, essentially, this is my attempt to play finance director, and Sam's in the back and she can correct me. But the revenue from any tax is recognized on our balance sheet in the year that it was levied. As you know, when we have individuals that don't pay, we assess interest and penalties, which is additional revenue, and people generally do pay those. Those that don't, if there are tax years that we ultimately don't collect because of they essentially age out of the opportunity to collect, it's viewed as a write-off. Those two things essentially on the balance sheet, generally speaking, it can be a wash. But it's not because you're getting more, looking at me perplexed. So the interest and penalties, correct me if I'm wrong, Mr. Chair, but interest and penalties about, is it 18%? So,
Yeah, the interest is 12% and the penalty is 6% per year.
So it's significant interest and penalties behooves people to pay on time. So those that pay late pay a higher amount. Ultimately, the pieces that we write off, am I essentially hitting it close enough, Sam? Okay. Do you want to grab a mic? You got to grab a mic.
Our finance director, Sam Fenske, please.
So the year that we levy it, we show it as a revenue, and then it sits on the balance sheet as an accounts receivable. So as we collect that cash, it goes there. But the interest and penalty then shows as a revenue in the year that we receive it. So as we write these off, we will have an expense on that year, but usually the interest and penalties that we get from delinquent taxes kind of offset it. But then with Act 216, we can keep the amount of interest and penalties that were incurred on each of these properties as we sell it up to that total dollar value. If you sell it for less than what that total dollar value is, you'll have a loss on it. But the whole point behind it is to kind of make it whole. At that point, anything in excess gets returned to the owner.
And I think that's why it does behoove us to address the backlog. And in fact, I'll be presenting on Tuesday. I'll be doing some work this weekend to kind of lay out what I think is a sound plan to have us make more progress on those properties.
To put a little context to the summary book that we have now, we know that there's over 4,000 tax certificates on various parcels in the county dating back to 2010. And the total amount of tax and special assessments that are tied up in that is over $5 million. And so I think to put context into what the budget amendment was, it was an attempt to address some of that backlog that's there, to be able to bring that into line and bring those properties back online into property tax paying. And not, and also, as Supervisor Marash alluded to, also part of the economic development. Any other questions on the budget? Supervisor Marshall?
Just a comment regarding the tax deeded properties. I believe that the legislature passed Act 207, which is revising the process for county disposition of properties obtained through tax foreclosure. The rules around that were developing, and that was a significant delay to us taking action on our tax deeded properties, if I remember that being told to us by the treasurer. So just as a point of reference, we have had delays due to new legislation.
Okay, anything further on the budget? We'll move on to review and discussion of Tuesday's meeting agenda items. Up under 9A is 9A1, Local Emergency Planning Commission. And I know I'm going to mispronounce this name, Junior Chinecki. Any questions on that appointment? And then the next item is item 9A2, the Joint City and Wausau Marathon County Homeless Task Force, the appointments there. We're waiting, and I've had discussions with the mayor. We're still waiting on one business community representative. I'm trying to get confirmation of that individual, and I actually received a phone call from that individual while we're in this meeting. So I will hope to have that appointment filled with the mayor's approval for next Tuesday's board meeting. Moving on to item 9B, ordinances. We have first up the Town of Ringgold zoning ordinance amendment. We also have with us our zoning administrator has joined us on WebEx, Shad Harvey, if there's any questions. And Supervisor Ritter, please.
Thank you, Mr. Chair. I start off, I can surely sympathize with the town of Ringgold and feeling that Marathon County, especially ERC, is kind of being bullies and pushing them to do something they don't want. It kind of started with our initial negotiations being closed session meetings, which is kind of what we have to do when we're negotiating with an outside contractor, but they felt we were being secretive and not including them. And then the fact that they overwhelmingly did not want this heavy industrial, and Environmental Resources Committee voted to move the heavy industrial forward to the county board. I'd like to give a little different point of view. The contract, the way it's written with Verity, states that in September of 2025, just under a year from now, the only thing that can happen on that property is capturing renewable natural gas. That's it. Nothing else. If they try to do anything else, they are booted off the property immediately. The gray area is between now and then. We really don't have any good zoning to regulate what they do there. So staff doing their research felt that heavy industrial was the one that most closely matched what was going to be going on there. So that we kind of felt at least gives us some control over what they do there between now and basically 11 months from now. So their concern of more heavy traffic because they're worried that in the meantime, Verity might slip something by us. They did kind of sneak by and do the Bitcoin mining, but as soon as they saw the backlash from it, they immediately stopped and moved the equipment out of there. So in my perspective, I kind of feel like we're protecting the town of Ringgold to give us an extra layer of control over Verity between now and September of 2025. Because after September of 2025, renewable natural gas is the only thing that can happen in that on that property. Now, if we would go to try to come up with a special zoning for that area, we were reluctant, number one, because you hate to get in that practice of doing special zoning for anybody that doesn't agree with us. And to put it in realistically, if we started the process today, I believe at very best it would take us several months for staff to draft a special zoning area and then go through ERC and then go through county board. That would only leave a few months in between that being adopted and September of 2025. So I do not feel that it's really worth it for us to go through all the work of developing a special zoning area only for a few months where the contractor is going to take over after that. And this being a relatively significant resource for the county and for Verity, nobody wants to screw up that contract. So that's just kind of a different perspective. In a nutshell, we really don't think it's worth our time and effort to come up with a special committee just for a couple of months when in September 2025, the contract will state the only thing that can happen there is collecting renewable natural gas. Thank you.
Just to give a little more context, so Viridia is the entity that this board has authorized and entered into a contract to generate renewable natural gas from the gas that is generated by the landfill. They're in the process of building that renewable natural gas facility. And so during the time that Supervisor Ritter referred to between now and September of 2025, when they become operational or are required to become operational in developing and producing renewable natural gas, is the time frame that is really potentially one of the concerns that the township has expressed. Now, anybody knows about how manufacturing and how building goes knows that if they're already starting the building process, they're not going to be moving a different kind of business into that on that 4.99 acre parcel, and then trying to continue with construction on the renewable natural gas facility. And as Supervisor Ritter alluded to, the contract is very specific, and it's specific in the fact that it's 20 years in length, that they can only produce renewable natural gas, and they have a pipeline access directly to inject the renewable natural gas that they produce into the pipeline that's on the south side of Highway 29. The other thing that's there in the contract is there's a 2 5-year options that they have to renew the natural gas production past that 20 years. So they could go out to as much as 30 years without renegotiating. If they ever cease natural gas production, this board would have to take action before anything else could be taken place on that property. And so there would be opportunity for the township to provide input into any future change in that operation. So it was under, as I viewed it, and I attended most of the ERC committee meetings in discussing this whole project and process of rezoning that parcel to a zoning district that exists in our zoning code. The zoning district that exists in our zoning code today is heavy industrial, and that's what would fit the use that the natural gas production facility will be. What the town of Ringgold was asking for is the development of a new zoning district, which would have to go out to, we'd have to get input from all 18 towns. We'd have to get consensus from all 18 towns. We'd have to have public hearings. And so Supervisor Ritter is correct in saying that in order to do that process, it would really take significant amount of time. And right now, the company Viridia is in the process of building the renewable natural gas facility. So I don't know that there's a lot of concern of something else going on that property. Supervisor Foote, please.
You kind of answered some of my question. I guess it sounded to me from listening to the committee meeting, there were more people from Ringgold. They sounded, and I also am questioning just what is heavy industrial, because it sounds heavier and worse than what they've got now. You know what I mean? And so it's kind of that thing of once you say, oh, you're zoned this, you could never go back to be zoned like a park. You know what I mean? So that's my question. I get it about the contract, that they can't break the contract. That's amazing, or whatever. That's great. but that's not till September 2025. Just that just seemed to me to be the problem. What can you do on heavy industrial that you can't do right now at the dump?
I guess I would, we have the zoning administrator, Shad Harvey, so I would hope that maybe the question belongs to Shad. Shad, please.
Yeah, absolutely. First, I just wanted to address, you're absolutely correct in the sense that if this property right now did go to the heavy industrial district, that doesn't mean it has to stay in heavy industrial forever. If for some reason that land use changed, it could be zoned into a different district in the future. Heavy industrial is just our zoning district that it does account for more of the, we'll call it undesirable uses. That's it's more or less like the concrete plants, a landfill, for example, which this surrounds this parcel. Processing, heavy processing. So processing the natural gas falls into the heavy industrial district, which is why this district was chosen, because it's the processing of natural gas. There's really not many districts in our zoning code right now, well, any other than the heavy industrial one that would account for the processing of natural gas. But it is an important thing to say that in the future, if the land use were, the landfill were to get reclaimed and natural gas would no longer be taken out of there, that property could be rezoned into a recreational district in the future. This is zoning district is just something along the line of it has a set amount of rules in it. So if something else was going to be done on that property, it's just another layer of protection as far as permitting. Some uses are permitted, some uses are conditional use. Conditional uses have to go in front of our Marathon County Board of Adjustment. They also get public input. They can put conditions on permits. So again, this is just kind of another layer of protection and the best zoning district in our code as it sits right now that fits what the use of that property is.
Okay, Supervisor Wilhelm, please.
Thank you, Chair. What I had explained to me what they're afraid of is long-term, would be a long-term having this heavy industrial if the natural gas production would go away and the county would bring something else in there that they couldn't control. That's what was brought to me and what their concern is. And they're looking at the future, not just today. And I think they're trying to address that so that they know that it would never happen, because it was explained to me that the county can do what they want, and that's what they were afraid of.
Yeah, and I think I'd be remiss if not I said that if there were a future change other than the current use that is under contract for up to 30 years, those decisions would have to go between the Solid Waste Board, ERC, and then ultimately this full board. So in other words, you couldn't put a concrete plant out there without having discussion by this board and taking action by this board and the Solid Waste Board, which has representation from the township on that Solid Waste Board.
And then just to add to that, like from a legal perspective,
there you go.
From a legal perspective, it might give them peace of mind, but they're no better off necessarily if you were to, like, let's say you go with a special zoning district. If the county later on wants to turn it back into heavy industrial because this gas is not working and the county wants to do something else there, the county at a later time can always change it. It would have to go through the process, but it's not like, it wouldn't be set in stone. Even if it was some special zoning district during the period that the contract was in place, that wouldn't be set in stone because the county could always change it at a later time.
But again, there would be processes that would have to go before the ERC committee. It would have to come to the board, and a change would have to happen by the board. Would have to take positive action or action to change it. Other questions? Supervisor Hoppe, please.
Thank you. I have a couple questions. First of all, it sounds to me like this is an ongoing contract.
The Verity contract is a 30-year contract with that company to develop a renewable natural gas facility and develop renewable natural gas from the gas that's extracted from the solid waste landfill site.
And I understand that, but it sounds like it has already started. I mean, this isn't something that's going to be brand new. It's like already
Well,
in place.
I guess there's two things. So prior to Verity coming in line, there was a entity out there that was taking the gas that was being, because there is, and maybe I'll invite the landfill director to give us a little bit of history about the landfill gas, the uses that has historically taken place out there, and what we're required to do as far as flare it. We're required to maintain and do something with that gas. So if Mr. Hagenbusher, please.
Yeah, am I all right back here?
Yes, you're fine.
Thank you. Yeah, thank you for allowing me to answer some questions here. So a little bit of background and context, and for those that may have been in some of the sessions earlier this year. So back in the mid-90s, landfill gas started to be extracted, and it can actually be used as a fuel because a lot of it is methane. That methane, by law, we do need to burn it. At one time, it was thought of as a waste product, and a contract was granted into perpetuity with this other entity called Fiber Recovery. In 1997, they came into the solid waste department, took hold of this 5-acre parcel, and for many years, they actually had engine generators on site where they were taking the landfill gas, burning it in these generators, and then we're basically putting that electricity back on the grid. That was a lucrative business for many years, but when power purchase agreements were renegotiated, it became not a viable option. For many years, they struggled to try to find a buyer for it, and late in 2022 and into 2023, began talking about a potential buyer. So they bought those shares of the fiber recovery business, and that's where we began talking with Verity. And it was a very short timeline. It was about 2 or 3 weeks where we sat down with Verity, negotiated a royalty for Marathon County for delivery of that landfill gas. So rather than getting nothing like we had for many, many years, we are finally getting a royalty for the landfill gas delivery for this natural gas plant. So what they'll do is they'll clean it up, they'll extract the pure methane, and then inject that into the A&R pipeline along Highway 29. So this 5-acre parcel, for those that don't know, so the solid waste facility is about 600 acres. The town of Ringgold has a siting agreement with Marathon County that governs any nuisance conditions. We actually provide compensation per ton to the township, along with many other benefits. But this 5-acre parcel does not have any governance over it, other than the Marathon County contract with Verity. So that's kind of the reason why we're looking at this zoning. And I do want to bring up a point that I thought was very important that Supervisor Longenhan made during one of the ERC meetings, is that we're making zoning decisions for what's going on right now, not zoning decisions at what could happen 30, 40, 50 years into the future. Thank you.
Thank you.
Other questions?
Yeah, I'm not done.
Go
Sorry.
ahead, Supervisor Hopper, please.
Another question is, I'm going to refer to Mr. Christian's letter that I think everybody got. And he was referring in there quite extensively about the lack of ability to handle some kind of a fire, explosion, anything else. He said they are not ready to handle that. And it wasn't addressed tonight when he spoke, and I didn't see a lot of it addressed in their meeting that I watched. And I'm just wondering exactly what the potential is, or do they have to jump up to meet code to have something in place to handle a fire or an explosion?
So Viridi is required under state law, state statutes to build that facility in accordance with those with fire regulations in mind, and fire suppression is one of those. And so yes, they are going to develop that. They have had discussions with asking for a potential variance on the facility versus having a sprinkler system on there. But that's getting way into the weeds. And so suffice it to say that the state building code, they are going to abide by that, and they are going to provide fire suppression in that facility that they're developing in accordance with state development. And Administrator Leonard would.
If I can offer one other thing, that is expressly required within our agreement that was negotiated that Dave referenced with Viridi. It requires that the purchaser, their responsibilities shall include but not be limited to air permits, building permits, local approvals, and state approvals. So simply put, they have to follow the rules. So if there's not a variance granted on that, they would be subject to those codes. We're not the county is not the individual or entity, I should say, that is involved in that variance process. They have to follow all the rules that they need to follow pursuant to our agreement and the extraneous laws or building codes that may apply.
Thank you.
Supervisor Jensen, please.
Thank you, Chair. Just to piggyback off of Supervisor Hoppa's question, do we know through any of the committees that have looked at this if the Ringgold Fire Department is capable to handle if called upon? We have, smoke detectors as part of building codes and things like that and various fire suppression, but you rely on the fire department to handle any emergencies or crises. So do we know if Ringgold Fire Department is equipped to handle it if they were called upon?
Yeah, I'd prefer to Administrator Leonard. I don't know that we're in a position to be able to answer that question. I think one of the things that I have seen is the design that they have looked at in developing various other facilities, and what they have put in meets state specifications.
Yeah, I don't hesitate to guess what the capabilities of, and I won't state what I believe to be anybody else's state of their ability to respond. I can get, if you'd like, information from our emergency management director or our dispatch to talk through mutual aid that exists for law enforcement. The same sort of thing exists relative to fire and EMS. So in the event that any one locality is unable to respond sufficiently for any event, there is a very specific process that is utilized in the event that they call for mutual aid or further assistance. So we have a fair number of entities that our emergency dispatch, our 911 center provides dispatch for. Some are volunteer, some are staffed differently during different periods of the day. Law enforcement, for example, we have some that handle normal business hours, and then the sheriff's office takes over for different hours. The same standard process would apply for fire response. If an individual responding entity is unable to meet the need, there's a process that they go to call for mutual assistance.
The one more thing I will say from a legal perspective is that the zoning designation would not have any impact on the fire department's capability, because whether it's zoned heavy industrial or some other zoning, the actual use and the building specifications, that's already dictated through the agreement. And so regardless of the zoning, whatever issues the fire department would have, they would have it regardless of what you as the board decide on the zoning issue.
Okay, thank you. And then just one other follow-up. So have any representatives from the Ringgold board, had their concerns resolved as part of, this explanation about the short-term zoning need?
I would say it's been explained to them. I think and I don't want to characterize what I think they took away from those meetings, but it's been explained to them.
Thank you.
Other questions? Okay, moving on to item 9B2, Town of Elderon rezone. Tim Vreeland for Keith Zimba. Any questions? Okay, moving on, 9B3, the Town of Hall rezone. Tim Vreeland for Mitch Gums. Ordinance 38-24. Any questions? Item 9B4, Town Hall rezone. Chris Schumacher for Leonard and Karen Reilly. Ordinance 39-24. Questions? Item 9B5, amending section 9.21 of the Marathon County General Code of Ordinances relating to disorderly conduct of to an election official. Ordinance 40-24. Questions? Item 9B6, adopting the Marathon County Comprehensive Plan 2024 amendment. We have the CPZ Director, Ms. Lori Miskimmons, to give a brief update on the amendment, and this is before the board.
Thank you, Chair Gibbs. This is one of two items on your agenda tonight related to the comprehensive plan. This first one is the one we discussed in the spring when you adopted the Farmland Preservation Plan. We discussed that in order to make that plan fully compliant for the state and keep our farmland preservation program and tax credits eligible, we need to amend our comprehensive plan. So the list of amendments has been provided, was provided to you in the spring. These are largely maintenance edits, is how the ERC has characterized them as well. Basically, in the document, we've gone through and updated references to make sure the comprehensive plan is now referencing the newly adopted Farmland Preservation Plan instead of the old one, and we've added the Farmland Preservation Plan as an appendix. As part of the state statute, we did go out to all the municipalities, town officials, city officials, village officials. We also reached out to non-metallic mine operators. That's required by statute as well. Published the edits on our website, made notice of public hearings and where people could review the edits at our library. In the paper, we only received 2 comments on this amendment. One was from a non-metallic mine operator just asking for clarification as to why they were being notified, and we let them know that's because the statute says they must be notified. And another was from a town just confirming that if the amendment goes through, does the town have to change their comprehensive plan? They do not. So their plan is their plan. We're only amending our comprehensive plan. So that's the first amendment that is before you. And later in the agenda, we'll talk about the other thing that's coming up with the comprehensive plan update for 2026.
Okay, any questions on the adoption of the Marathon County Comprehensive Plan, as we've called it, an update or amendments to bring that plan into compliance for the Farmland Preservation Program and the farmers to receive the farmland preservation tax credits? Okay, we'll move on to item 9B7, increase the medical examiner's fee as permitted by state law. Ordinance 42-24. Any questions? Okay, next we'll move on to resolutions. And we have resolutions coming from the Executive Committee, 9C, 1A. And this is the other one that Ms. Kimmons was talking about, and that is the adoption of the Public Participation Plan for Marathon County's Comprehensive Plan 2026 update, Resolution 43-24.
Thank you, Chair Gibbs. Yeah, microphone's on. So at the same time, when we're asking you to just complete this quick amendment of the comprehensive plan, we're also pivoting to the larger update of our comprehensive plan that was first adopted in 2016. The first step in doing that is to adopt a public participation plan. So we have worked with the executive committee, who is going to oversee the update of the comprehensive plan, to put that public participation plan together. The public participation plan really focuses on just how we're going to communicate with and get input from the public as we update our plan. It includes both external and internal processes that we're going to follow. I think a couple important things to know about this plan is that as we update individual chapters within the comprehensive plan, we'll be working with the department heads and the respective standing committees to first look at and edit goals and objectives in that comp plan, and then be bringing them to the executive committee for discussion. As it relates to external processes, we have 4 main points of engagement within the comprehensive plan update that we will engage the external public. In early 2025, we plan to start having informational meetings with the public to sort of take a pulse in terms of what are the issues and concerns in our community, and talk to them also about how the county can have influence or impact as it relates to those concerns or issues, so that then we can bring those into discussions to develop new goals and objectives for the comprehensive plan. Later in 2025, we'll then go back out to them after we've started to develop and update the chapters, and talk to them about the draft that is starting to take shape, and take a pulse on whether or not the goals and objectives that are in that draft are reflective of the Marathon County community. We'll also plan to do a survey in the fall of 2025 to, again, get another pulse on whether or not our updated plan is reflective of our community, and also ask the community to weigh in on what they see as the priorities for the county board to address. Because following the adoption of the comprehensive plan, the next thing this board will start to look at is what your next strategic plan looks like. So we'll want that input in order to guide you in developing the strategic plan that comes out of the next comprehensive plan. Finally, in early 2026, prior to adopting the comprehensive plan, we'll also have a public hearing where members of the public can come and speak about their thoughts on the plan that's before the county board to adopt. So those are sort of the main components of the public participation plan. The other thing that's in there that I think is worth mentioning is that we are going to have a lot of ongoing and regular interaction with our town officials. We want to make sure we're getting that input from the town perspective as well, to make sure our plan is reflective of our towns. And as you may or may not know, CPZ is going to be relocating to Lakeview next year. So we are definitely in the process of liquidating everything we have in our building. And we have, I believe, the last box of the 2016 comprehensive plans, unless Administrator Leonard still has one, I'm not sure. So I have about 10 hard copies of the 2016 plan left. I did put an insert in here that explains the minor changes from the Farmland Preservation Amendment as well. So if anyone wants those, I'm giving them away and back, and I'd love to get rid of them because we're not taking them to Lakeview. So, and I'll take any questions you have about the public participation plan.
Any questions on the public participation plan of the comprehensive plans of 2026 update? Supervisor Sandulski, please.
So is the public, like through the year, is the public going to be able to weigh in on it, like in the hearings and stuff, or is this just going to be a one-time hearing for the public to?
Yeah, so I think the public will have multiple opportunities through public meetings to weigh in. The public hearing is the official hearing at the end that is also done prior to the county board adopting. So.
Thank you.
Any other questions on the 2026 public participation plan? Okay, thank you, Lori. We'll move on to item 9C2 from the Extension, Education, Economic Development Committee. Item 9C, 2A, a resolution calling for state elected officials to work collaboratively to address the child care shortage in Wisconsin, Resolution 44-24. Any questions? Okay, moving on to item 9C3, Health and Human Services Committee. Item 9C3A, a resolution in support of Operation Greenlight. Any questions? Okay, moving on to Human Resources, Finance and Property Committee, 9C, 4A, acceptance of a donation for the Regional Forensic Science Center, Resolution 46-24. All right. And then moving on to 9C, 4B, a resolution approving the sale of 405 South 8th Avenue, Wausau. Resolution 47-24. Any questions? Supervisor Sandalski, please.
Right. Thank you, Mr. Chair. So I got a few questions in relation to this. So from my understanding, the property at 405 8th Avenue was appraised at $99,000. The first question I'm going to ask is why are we selling it at a reduction of 40% below the appraised value to Wausau? And in the second, I got more questions coming, but in our current real estate market, properties in many cases are selling above the appraised values, as it is not fair for the taxpayers of Marathon County. Like as Supervisor Robinson talked about before, we want to try to get properties back on the tax rolls, so they're contributing to the taxes and that. And the last questions I guess I got is there a possibility we could either have the administrator go back and renegotiate with the city, or a possibility of getting this getting it on the real estate for like a private sale? So I guess that's all I have.
Supervisor Robinson, please.
The committee looked at the difference between the appraised price and the offer and decided to accept the offer with some conditions. If they don't develop it, we have the right to purchase it back for our costs. And the discount was, one of the reasons the discount was given was that there are some development costs to prepare the property. This county board has adopted, I think, Resolution 6624, where we talked about the importance of housing and trying to get property into housing to try to deal with a critical need from an economic development perspective. This is one of those goals. Typically, when we have tax delinquent property and other property, we look to work with local units of government relative to the redevelopment of those properties. In this case, the city, through its Community Development Authority, was very interested in that for housing. It addresses a critical need. Yes, we are receiving less, but it reflects the cost to develop that property, and that's why we sold it for, or agreed to accept the offer for less money under the appraised value. But again, it's trying to meet that commitment of trying to get more property into the housing or create more housing in the community to address that critical shortage.
And again, there's a restriction in the covenant, in the sale agreement, that says that the property has to be developed into housing within a certain period of time. If that does not happen, then the property can be reacquired for the sale price that we sold it for. So we would be able to reacquire it. Any other discussion? Okay, moving on to Human Resources, Finance and Property Committee and Executive Committee, a resolution approving the broadband expansion loan agreement, Resolution 48-24. Okay, we'll move on to Human Resources, Finance and Property Committee and the Public Safety Committee. Item 9C, 6A, a resolution to amend the 2024 annual budget to accept award funds under the 2024 Bureau of Justice Assistance Smart Protection Grant, Resolution 49-24. Any questions? Supervisor Marshall, please.
Thank you, Mr. Chair. Is the intent that after the 3 years, this position is no longer needed? Or is that something that is going to be needed to be funded by the county?
Well, people are looking at me, so I'll start, and then anyone from the district attorney's office can certainly elaborate. The grant is for the grant term, like any position that is funded by a grant. At the end of the grant, absent action by the board to allocate funding, the position would go away. So I don't know if Ruth has anything you want to add to that, but right now the funding as provided in the budget amendment, it's envisioned through 3 years.
A lot of these grants, we don't know now if it can be renewed. So at the end of the 3 years, it might not be possible to renew. It might be possible to renew. So we can't really say. But worst case scenario, we can't, and we lose the staff.
But again, I think the point the administrator is making is without action, the board would have to take action to fund it if it was going to fund it once the funding, the grant funding is eliminated. Other discussion? Okay, we'll move on to item 9C, 6B, the creation of 1.0 FTE deputy sheriff in Marathon County Sheriff's Office to provide contractual services for the Village of Rib Mountain, Resolution 50-24. Any questions? Okay, moving on to item 9C7 from the Public Safety Committee. 9C7A, a resolution in support of the Marathon County's District Attorney's Office request for in connection with the state of Wisconsin's 2025-2027 biennial budget, Resolution 51-24. Any questions? Okay. Announcements and/or requests. Any announcements and/or requests? We are down to item number 11. What is your pleasure? Motion by Supervisor Covelli and seconded by Supervisor Marash to adjourn. All those in favor of adjournment signify by saying aye. 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 Opposed, say no. We stand adjourned. Thank you, ladies and gentlemen, and we will see everyone here, smiling faces, next Tuesday.